In this video, I will be doing a full breakdown of the lumbar multifidus muscle group, a main cause of low back pain and back spasms. Expect to learn the function of the muscle, clinical presentations when dysfunction is present in the muscle, detailed palpation instruction, and functional-based treatment demonstration. For those of you that don't know me, my name is Dr. 𝘍𝘠𝘠𝘠𝘠𝘠𝑐𝐻. I am a soft tissue injury treatment expert, specifically for neck, shoulder, sciatica, and hip pain. My focus is on finding and fixing adhesion and reducing inflammation from chronic injuries without the use of drugs, injections, or surgeries, which does lead to a significant increase in overall functioning, flexibility, and long-lasting pain relief. I'm also the founder of the Soft Tissue Treatment Revolution, where we teach overworked massage therapists a new treatment system that will allow you to cut your treatment times by at least 50% so you can stay healthy, avoid the dreaded burnout, and help a hell of a lot more people get out of pain. All right, so lumbar multifidus muscle breakdown, function, clinical presentations, palpation, and treatment demonstrations. Let's get right into it. So function of the lumbar multifidus muscle group, it stabilizes and supports the low back, basically it really supports the entire spine, but I'm specifically talking about the lumbar muscles. Supports basically from S2 all the way up to L1. It's really important in pushing from the low back, and it provides like a counter force to keep you from falling backwards. So say you go to push a door open or you do something there, those muscles provide a counter force to keep you from falling over and also produce flexion of the lumbar spine. They're so important and they cause a lot of issues because they're right along the spine, right there, dead center off to each side there across the spinuses and the laminar junction there. And they have a lot of important function in the spine, especially stability, movement, everything like that. And they really get beat up in a lot of chronic low back issues. So some common injuries associated with lumbar multifidus dysfunction. One is just going to be generalized low back pain. A lot of times you'll see things like lumbago or lumbago or however the hell you say it, or just back pain. And a lot of times the lumbar multifidus is one of the contributing factors in. Sciatica as well. I don't really like the diagnosis of just sciatica. It doesn't really tell us a lot. We want a tissue-specific diagnosis about what's going on. Definitely disc injuries, specifically herniations and bulges. So basically over time, when the multifidus gets beat up, it can get beat up with accidents, trauma, sitting too much, doing too much overall, doesn't get enough blood flow, doesn't get enough oxygen, actually starts to lay down adhesion, also known as scar tissue, and it makes the area less flexible and weaker. And the job of that multifidus is to support and stabilize the spine. It can't. So it in turn puts more wear and tear and more force into the disc, into the joint as well. So a lot of times these herniations and bulges happen after the multifidus has been built up with the adhesion. So a lot of times they go to the orthopedic doctor and the orthopedic doctor's like, oh, you got disc problems on MRI. The disc is the problem. No, the disc is the effect. It's not the actual cause. Another common one is just back spasms. When the back is spasming up and tightening up, a lot of times it's doing that for a reason to protect that area. So a lot of people are like, oh, the QL is firing and going crazy. It's doing it to protect the underlying problem. And a lot of times the underlying problem is definitely going to be some damage to the disc, to the joint as well, which was caused by the multifidus scar tissue accumulation. So if you go in and just release the spasm in the QL, you're actually taking the force and putting it more into that area. The spasm is actually happening as a protective way to unload the tissue. I say the same example happens when you sprain your ankle. Your body knows to limp because it doesn't want to load that dysfunctional tissue. And that's what's happening with the back spasm. And then lastly is this tight hamstrings. The hamstrings end up being a secondary stabilizer to the low back when there is problems in there, and they just tighten up in a protective way. So they always feel tight. And most people think, oh, you just need to stretch them. No, you must understand why they're tight in the first place. And a lot of times because there's underlying issues in the muscles, in the disc, in the joint itself. So how to find it? I always say, if you can't find it, you can't fix it. So what I'm going to link up in this part of the video is a detailed palpation about how I use landmarks and how I palpate not just the multifidus, but also the other erector groups, including iliocostalus, longissimus, and really getting in there using landmarks and finding that. So I'm going to link that up right now. Next thing we're going to do is we're going to get in here and we're going to check the erector group. So it goes multifidus, longissimus, iliocostalus. So multifidus goes right in through there, and I'm going to get in here and just palpate. And what I'm feeling for is that area of that scar tissue or that adhesion. And it's usually going to be in the area that's limited. Then I'll work my way up, get longissimus on that side. And then the last one is iliocostalus. Everyone forgets about iliocostalus, but in order to get this one, you kind of got to come in off of the side here and bow in through there. And it's usually pretty tender, and a lot of people leave that portion on there. Here's a couple take-homes from the video. You want to make sure you slow down, use landmarks, don't be in a rush. It's going to really get you in the right place if you can just slow down and not just trying to jump in and do a bunch of treatment, but doing the right treatment. So how to effectively treat it? I talk about this in all the videos, but you want to be slow, precise, and focused. Don't be in a rush. You want treatment to be like a medication. You want to do enough to be effective, but you don't want to over-treat it and in turn cause a lot of flare-ups and cause more inflammation in there. Next thing is you want to use landmarks to know you're exactly on that area. So I would say 1 thumb width out from the SPs all the way from L1 down to S1 is going to be where that multifidus lives. It's going to live right in that gutter. So what I want to include next is a treatment demonstration of me treating the multifidus using landmarks, using body position, getting leverage, getting depth, getting tension. So I'm going to link that up right now. What we're going to do is be treating the lumbar erector muscles from the floor in this quadruped position. So the key here, get yourself a yoga mat or something that the client can lean on, is the client's going to help with that motion. We want to make sure everything's lined up nice. The shoulder is just parallel down to the wrist. Hip is parallel down to the knees. And the motion for the client is they're going to start by sinking down, and then you're going to have them do a nice ab crunch and come up just like that. And they're going to go really slow. This one's a little harder as you get there. The client's going to want to go really quick like that, or they're going to want to add in a lot of this extra. You don't need all that. All you really need is this motion just right through here. So after you've palpated and you found the area where that decreased compressibility is and you've marked it with a marker, that's going to make your treatment a lot easier. We found the area where the scar tissue is and we marked it with a marker. You did the work for the palpation, now it'll make it easier. Now, very similar to how we do our warm-up and get everything in the right place, this is what's going to show you on the treatment. So the client is going to drop down into extension. So the first thing you're going to do is you're going to have this opposite leg back just like this. The other foot is going to be parallel right to where that problem is. It's going to be lined up. It's going to be lined up exactly where it is. So if you're familiar with warrior stance, and we showed it in the warm-up, this is where it's all going to come together. So I start by facing here, and the first thing I want to do is I am going to twist and be here because my tension is going to come from this lean. So we found the area here, and what I do is I'm able to get in there backed up with my thumb, just like that, and then I'm going to take the other hand and I'm going to sink in right there. I'm going to be just inferior to it. And it's going to be internal slide, it's going to come to me. So the first step is, come back up for me a little bit. The first step to get our depth is we're going to sink in with our sternum straight down, and then we're going to back out a bit, and then our tension is going to be lean with the body. Then the client's going to come up through that motion nice and slow, and you're going to let it come up to you just like that. So the key is they're going to sink, and you're going to reset each time. We're going to sink straight in, we're going to back out a bit, and then our tension is going to be that lean with our knee and pushing through that back leg and letting it come up to me. And that's going to get a very effective treatment. Now the key here, and what you'll start to see, is in the motion. A lot of times what happens is people don't get that tension and that lean, and that's where the setup will be in your warm-up and your practice, is like getting you into that warrior pose where you're here, and you go here, get that depth, and you get that tension, you get that lean, and you let it come to you. It's all about your core and your stability. You don't want to work any harder than you need to, because if you can effectively treat this area, it's going to really open up and take some of that pressure off of the low back. So a couple take-homes from the video. Always proper depth, and then tension. You want to feel the tissue slide. A lot of people, when they look at this, they think it's pin and stretch or some form of myofascial release. Maybe on the surface it looks like this, but the touch and feel is very precise, very focused. We're getting an effective treatment every time. We're not putting that disc in the joint in a bad place. We're not creating a ton of inflammation. We're just being effective, getting the right dosage each time. And wherever I find a real decreased area of palpation, that's where that adhesion is present, where that dysfunction is. I never want to do more than 5 to 7 treatment passes on that area. Anything more than that will really just be overkill. So that's all I got for you guys in the video. If you're struggling to figure out exactly what is going on with your client's injury presentation, you feel like you're stuck guessing and always on a path to learn some new type of advanced technique, only to be stuck in the same loop of winging it and trying more stuff, then go download our free training modules that help change the way you think critically about figuring out the issue and treating in a new way that gets long lasting results, and get on the path to being a true problem solver. Links to that can be found in the description box below. I appreciate you watching, and we'll see you on the next one. Bye.